squamous epithelial layer and just deposit it back, that pocket handle flap, so that you can practice. Then you can do hypotympanotomy. Hypotympanotomy, you must learn to do hypotympanotomy. You can slightly drill the outer wall of the hypotympanum and you can see the hypotympanum. Once you see the hypotympanum, then in hypotympanum, what are the things? Hypotympanotomy is important for limited tumors of the glomus tympanicus. If you want to remove a glomus tympanicus, this hypotympanotomy, endometrial hypotympanotomy is enough for removing a glomus tumor. Then you can see that is the area in hypotympanum. You find the tympanic plexus. So identify the tympanic plexus and just cauterize it, or you can just, with the help of any sickle knife or anything, you can ablate it. So that is tympanic neurectomy. Which is done in cases of Frey syndrome, gastrectomy, that is known as gastrectomy sweating. That is a complication of superficial parotideectomy, where whenever a person eats, then there is salivation from the parotid skin area. And if you want to do that, you can do tympanic neurectomy. Then you can do canalplasty. If you want to widen the external canal, then because the external canal is now exposed, you have elevated the natal skin, then you can widen the canal. It is always better to have a glimpse of the anterior and anteroinferior end of the tympanic membrane or fibrous annulus. If you are able to get in one picture, if you are able to get all the margins of the